Good day, sir. I am Doria Tugaw from 3BSNB and I am here to perform a return demonstration on inserting nasogastric tube. The nasogastric tube is passed through the nose and into the stomach. This type of tube permits the patient to receive nutrition through a tube feeding using the stomach as a natural reservoir for food. Now let's proceed to the proper procedures. First, verify the medical order for insertion of nasogastric tube. This ensures that the patient receives the correct treatment. And then, after that, perform hand hygiene and put on PPE if indicated. Hand hygiene and PPE prevent the spread of the microorganisms. And PPE is based on transmission precaution. So, since wala akong kasama para mag-secure nito, ako na lang ang magsisecure. And then, next procedure, identify the patient. Identifying patient ensures that the correct patient receives the intervention. Ma'am, ano pong name nyo? Okay. And then next procedure, explain the procedure to the patient. Ma'am, maglalagay po tayo ng nasogastric tube. Idadaan po natin ito sa inyong ilong. And then explain the rationale why the tube is needed. Explanation facilitates patient's cooperation. Ma'am, maglalagay po tayo para po kahit hindi po kayo makaswallow, ma-receive nyo pa din ang nutrition na kailangan ng katawan nyo. And discuss the associated discomforts that may be experienced and possible interventions that may allay this discomfort. So, based on patient surveys report, of all routine procedures, inserting the nasogastric tube is the most painful. And applying lidocaine gel or spray is a possible option to decrease this discomfort. So ma'am, ang procedure po na ito ay masakit po ha, pero pwede po tayo mag-apply ng lidocaine gel para po i-decrease ang discomfort na to. And answer any questions as needed. Next procedure po, gather equipment and select the appropriate nasogastric tube. So, nandito na po lahat ang ating equipment at ito po ay ang ating nasogastric tube, size 18 French. This provides for an organized approach to task. NG tube should be radio opaque, contain clearly visible markings for measurement, and may have multiple ports for aspiration. So, next procedure, close the patient's bedside curtains and door. This provides patient's privacy. So, assuming na naka-close na po natin ang ating curtains and ang ating doors. Next procedure po, raise bed to a comfortable working position, usually elbow height of the caregiver. This prevents back and muscle strain po. Okay, so assuming na na-raise na po natin ang ating bed. Next procedure po, assist the patient to a high Fowler's position. Upright position is more natural for swallowing. So, ma'am, high Fowler lang po tayo, ha? Okay, and then next, drape chest with bath towel or disposable pad, have emesis basin and tissue handy. Ang passage of tube may stimulate gouging and tearing of the eye. So, maglalagay tayo ng pad sa chest ng ating patient. Then, mag-prepare tayo ng basin na may with tissue handy. Yan. And then, next procedure, put on gloves. Okay, and then after that, measure the distance to insert tube by placing, by placing the tip of the tube into the patient nostril, extending it to the tip of the earlobe, and then extending it to the xiphoid process. Yan. And then mark with indelible marker or pwede tayo magamit ng tape. So tape na lang tayo. Measurement ensures that tube will be long enough to enter the patient's stomach. Next procedure. Okay. Next procedure, lubricate the tip of the tube at least 2 to 4 inches with water-soluble lubricant. Lubrication facilitates easy insertion of the tube. So, maglulubricate tayo ng 2 to 4 inches. Ito yung water-soluble lubricant natin. Ang water-soluble lubricant will not cause pneumonia if the tube accidentally enters our lungs. Okay, 2 to 4 inches. Okay. And then, after that, apply topical anesthetic to nostril and oropharynx as appropriate. Topical anesthetic decrease discomfort. So, pwede tayo mag-apply ng topical anesthetic. Next, select the appropriate nostril. Ask patient to slightly flex his head against the pillow. Ma'am, flex lang po natin konti ang ating head against the pillow po ha. Kasi magse-select po tayo ng nostril po. Okay. After selecting, gently insert the tube into the nostril while directing the tube upward and backward along the floor of the nose. Patient may gag when the tube reaches pharynx. So, gently insert it. And following the normal contour of the nasal passage while inserting the tube reduces irritation and the likelihood of mucosal injury. The tube stimulates the gag reflex readily. So, gently lang ang pag-insert natin. Yan. And then, after that, provide tissues for tearing or watering of eyes. Offer comfort and reassurance to the patient. Tears are natural response as the tube passes into the nasopharynx. So, magpo-provide tayo ng tissue sa ating patient kapag may tears tayong nakita. Okay. And then, after that, when pharynx is reached, instruct the patient to touch chin to chest, bringing the head forward, help close the trachea, and open the esophagus. Ma'am, mag-ano lang po tayo, ganito po tayo, ma'am. Ganyan. And then, encourage patient to swallow even if no fluids are permitted. Swallowing helps advance the tube, causes the epiglottis to cover the opening of the trachea. So, ma'am, pag sabi ko ng lunok, lunok po kayo, ma'am, ha? And then, advance tube in downward and backward direction when patient swallows, stops. Stops when patient breathes. So, ma'am, lunok, 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 lunok. So, nag-end tayo sa gimarkahan natin kanina. And then next, if gagging and coughing persist, stop advancing the tube. Stop advancing the tube and check placement of tube with tongue blade and flashlight. Excessive coughing and gagging may occur if the tube has curled in back of throat. Forcing the tube may cause mucus injury. Okay, so i-check natin. So, okay naman ang placement ng ating tube sa ating pharynx. And then next, if tube is curled, straighten it and attempt to advance it again. Keep advancing the tube until the pen marking is reached. And then do not use force. Rotate tube if it meets resistance. Okay, so wala namang resistance, so okay ang pag-flow ng ating tube sa ating patient. Next procedure. Discontinue procedure and remove tube if there are signs of distress such as gasping, coughing, cyanosis, and inability to speak or hum. The tube is in the airway if the patient shows signs of distress and cannot speak or hum. Okay, and then if after 3 attempts, nasogastric insertion is unsuccessful, another nurse may try or the patient should be referred to another healthcare professional. Now, next, secure the tube loosely to nose or cheek until it is determined that the tube is in the patient's stomach. Securing the tape stabilizes the tube while position is being determined. So, i-secure lang muna natin siya, pero loosely lang, hindi pa ito yung final na pag-secure natin. This is para lang natin ang placement ng ating tube. And next, Attach syringe. Next, attach syringe to end of tube and aspirate a small amount of the stomach content. The tube is in the stomach if its content can be aspirated. pH aspirate can then be tested to determine the gastric placement. Okay, so i-assume natin ang ating syringe is 50 ml. I-attach natin to sa dulo ng ating tube. Mag-aspirate lang tayo ng konti. Okay, naka-aspirate na tayo. And then, measure the pH of aspirated fluid using pH paper or meter. So, place a drop of gastric secretion onto pH paper or in a small plastic cup. So, ito yung pH paper natin. Maglalagay lang tayo dito ng drop lang. Ganyan. And then, within 30 seconds, compare the color of the paper with the chart supplied by the manufacturer. So, ito. The use of pH is predictive of correct placement. The pH of gastric contents is acidic. It is less than 5.5. So, ito, 4 lang siya. So, less than 5.5. Therefore, ang placement ng ating tube is tama. Now, i-attach ulit natin ang ating syringe. Attach the acceptor syringe again to the nasogastric tube. And visualize aspirated contents, checking for color and consistency. So, gastric fluid can be green with particles of white or brown if old blood is present. Okay, so may greenish ang ating content. So, therefore, tama ang placement ng ating tube. Next, obtain radiograph or x-ray of the placement of tube based on facility policy. The x-ray is considered the most reliable method for identifying the proper position of the nasogastric tube. And then next, remove gloves and secure the tube with tape to the patient's nose. Secure it like this. Skin barrier improves adhesion and protects skin. Constant pressure of the tube against the skin and mucous membranes may cause tissue injury. So, first, kapag secure natin ng tape, ganito, cut 4-inch piece of the tape and split bottom 2 inches or use package nose tape for nasogastric tube. So, ganito, na-split na natin. I-move lang natin yung kanina na tape na ginamit natin. And then next, place and split end over the bridge of patient's nose dito. And then next, wrap split ends under the tubing and up and over onto nose. So, wrap under the tubing and up onto the nose. Wrap under the tubing and up to the nose. And then next, put on gloves. And clamp tube and remove the syringe. Clamp tube and remove the syringe. Cap the tube or attach tube to the suction according to the medical orders. Suction provides for the decompression of stomach and drainage of the gastric contents. So, ika-clamp lang natin. And then, i-remove natin ang syringe. And then, ika-cup natin dito. So, assuming na na-cup na natin or na-attach sa ating suction. And then, next, measure length of exposed tube. So, since wala namang exposed tube sa ating patient, wala na tayong i-measure. Ibig sabihin lang, walang dislodgement na nangyari. And then, reinforce marking on tube at nostril with indelible mark. So, magmamark lang tayo dito para sure yung markings natin. And then next, ask the patient to turn the head to the side opposite to the nostril in which the tube is inserted. Ma'am, harap lang po tayo doon, ma'am, ha? Turn niyo lang po ang head niyo kasi secure po natin ang inyong tube sa inyong gown po. And secure tube to patient's gown by using the rubber band or tape and safety pin. Tube length should be checked and compared with this initial measurement in conjunction with pH measurement and visual assessment of aspirate. An increase in the length of exposed tube may indicate dislodgement. And for additional, so wait lang, ma'am, turn lang po ang head natin, ay secure lang po natin ang inyong tube sa inyong gown. Okay. And then, for additional support, the tube can be taped onto patient's cheek using a piece of tape. So, next, assist with or provide oral hygiene at 2 to 4 hour intervals. Lubricate the lips generously and clean nares and lubricate as needed. Offer analgesic throat lozenges or anesthetic spray for throat irritation if needed. Oral hygiene keeps mouth clean and moist, promotes comfort, and reduces moist. So, mag-assist tayo sa kanya ng oral hygiene and also mag-lubricate tayo ng kanyang lips and nares. And i-clean din natin ito. So, assuming na nagawa na natin, next procedure, remove equipments. Remove equipment and return the patient to a position of comfort. Remove gloves and raise the side rail of the bed. This promotes patient comfort and safety. Removing gloves properly reduces the risk of infection and transmission and contamination of other items. So, after natin ma-remove ang equipment, ma'am, balik na po kayo sa position niyo po. And then next, remove gloves. And ilo-lower natin ang side rail ng ating bed. So, assuming na lang yon. And for the last procedure, remove additional PPE if used. Perform hand hygiene. Removing PPE properly reduces the risk of infection, transmission, and contamination of other items. And hand hygiene deters the spread of microorganisms. Thank you. Ilang minutes?